Om Amiteshwariya Namaha. Dr. Manisha, Dr. Srivalsad, Dr. Manoj, distinguished faculty and delegates, thank you for having me present briefly on sustainability-related drug disaster relief and risk reduction in disaster management. Sorry, it's not moving. Yeah. So today being the International Day for Disaster Risk Reduction, which was started way back in 1989 by the UN General Assembly. In 2009, the UNGA officially designated 13th October as the date to commemorate the day. The International Day for Disaster Risk Reduction is an opportunity to acknowledge the progress being made towards reducing disaster risk. The current edition focuses more on international cooperation for developing countries to reduce their disaster risk and disaster losses. Unlike our earlier observation that disasters tend to occur in a higher income group, we now know that the low and middle income countries disproportionately have a higher mortality, and the numbers of people injured, displaced, and homeless tend to be much greater, with a much larger economic loss. We cannot eradicate poverty and hunger, it is said, if we cannot invest in disaster risk reduction. And this is very critical, particularly with all the climatic changes and the increased incidence of natural disasters. This day celebrates how people and communities around the world are reducing their exposure to disasters and raising awareness about the importance of reining in the risks they face. At local, regional, and national level, capacities need to be strengthened urgently because disaster risk reduction is very crucial, and it's people-focused and action-oriented in its approach to disaster risk reduction. This year's International Day for Disaster Risk Reduction is all about governance. And good disaster governance tend to reduce the number of disaster-affected people and reduces the economic loss. And we have seen this in the COVID pandemic and the climate emergency that we see around the world, that's telling us that we need to have a clear vision and plan and be competent and empowered institutions acting on scientific evidence. This year's theme is about conveying the message that many disasters can be avoided or prevented if a risk-informed approach to the development, construction, and maintenance of critical infrastructure in order to ensure that creation of new risk is avoided and critical infrastructure continues to function during and after the disaster. So it is said that if it is not risk-informed, it is not sustainable. And if it is not sustainable, it has a human cost. An increasing exposure of critical infrastructure and economic assets has been the major cause of long-term increases in economic loss from disasters. Investment in disaster risk reduction really has an enormous effect on cost savings and avoid losses and reconstruction costs from 3:1 up to 15:1 or even higher. So integrating disaster risk reduction into investment decisions in infrastructure building is a very cost-effective way to reduce risk. Investing in disaster risk reduction is a precondition for developing sustainability in a changing climate. So the adoption of hazard-resistant building standards, planning and environmental regulations, and overall strengthening of risk governance protects people from vulnerable infrastructure. Weak implementation and enforcement mechanisms is the cause of a lot of problems. When critical infrastructure fails, businesses experience losses, there is supply chain interruption, consequently production, output, and throughput are all reduced, and we experience a severe economic downturn. Resilience, therefore, has to be embedded in all business planning for new cities, towns, schools, colleges, hospitals. The high structural vulnerability is particularly seen in public buildings, housing, schools, and other assets in poor rural areas that are exposed to floods and tropical cyclones. Low intensity of damage to housing and local infrastructure can be a dangerous situation because even slight changes in the environment can produce severe damage following a low intensity damage. Deployment of healthcare risk management is another important area. Coming back to healthcare. Healthcare has been substantially involved in risk management, and in earlier days it was focused on patient safety and reduction of medical errors that jeopardize an organization's ability to achieve its mission. But today, with the expanding role of healthcare technologies, increased cybersecurity concerns, fast pace of medical science, industries ever-changing regulatory, legal, political, and reimbursement climate, healthcare risk management has become very complex. And every major hospital has a senior member of the administration who runs the department of healthcare risk management. So most hospitals are expanding their risk management programs from ones that were primarily reactive and promote patient safety and prevent legal exposure to ones that are increasingly proactive and view risk through a much broader lens of the entire healthcare ecosystem. So healthcare risk management comprises systems and processes to mitigate and prevent risk. And risk management in healthcare comprises of both clinical and administrative systems, detect, monitor, assess, mitigate, and prevent risk. Healthcare organizations proactively and systematically safeguard patient safety, and this has been shown time and again to improve patient care outcomes as well as reduce the cost of healthcare substantially overall, not only of the infrastructure, but overall operations of the hospital. Key components of performing risk management in healthcare is to navigate the healthcare risk continuum, and risk managers need to involve themselves in closely identifying the risks, analyze, act, monitor, and control all these aspects of risk management in a hospital. One needs to think beyond the obvious and uncover latent failures, deploy proven analysis method. A robust risk management system is very crucial. Risk and uncertainty are inevitable in healthcare organizations. Being a very complex organization, it is subject to all kinds of problems, including disasters. Human nature, the provision of intricate and multifaceted care, and the highly complex system of healthcare guarantee that we will face adverse circumstances. So one needs to set up a good healthcare organization risk management plan, which becomes the guiding document for the organization. And these risk management plans communicate purpose, scope, and objectives of the organization's risk management protocol. The second area in healthcare that is important to recognize in the context of disaster management is tackling non-communicable diseases in the context of disasters. The policy implications for managing disaster for better protection for people with NCDs. And the reason we say that is 77% of the patients involved in a disaster have non-communicable diseases, and 40% of them require treatment for non-communicable diseases and not for disaster-related injuries. So when we plan a disaster relief effort, we need to understand the demographics of that area and the incidence of NCDs, because a lot of the individuals in the community will need to be treated for NCDs and not for accidental injuries, which they may not sustain. So of all the major health threats to emerge, now if you can see on a t-shirt, we have the term non-communicable diseases, the slow motion disaster. Non-communicable diseases really represent 8 to 10 common entities, which I will allude to as we go along. Of all the major health threats to emerge, the very foundations of public health has been singularly stressed by non-communicable diseases, which includes heart disease, cancer, diabetes, chronic respiratory diseases, which were once linked to affluent societies, but now it is present globally, and the poor suffer more than the affluent. And these diseases share 4 risk factors: tobacco use, use of alcohol, unhealthy diets, lack of physical activity, and all of these really represents community-based action plans are what is going to be most effective rather than medical. Top 10 causes of death are all representing non-communicable diseases, which is coronary disease, stroke, lower respiratory infections, COPD, lung cancers and other cancers, diabetes, Alzheimer's, tuberculosis, road traffic accidents, as well as airplane accidents and so on. So health in all these regions is being shaped by the same forces. And if you look at it in the broader sense, really speaking, the slow disaster that we are all facing relates to demographic aging, rapid urbanization, and the globalized marketing of unhealthy products. The inclusion of an ambitious target for risk reduction premature deaths from non-communicable diseases is the agenda for sustainable development and formalizes the elevated place of these diseases in the international agenda. So prevention in non-communicable diseases is a major aspect, and prevention can be primary, secondary, and tertiary. As we all know, primary prevention is to prevent disease that has not occurred. Secondary prevention is to reduce the impact of disease that has already occurred by treating the disease and encouraging various strategies to prevent re-injury and recurrence. Tertiary prevention aims to soften the impact of ongoing illness that is incurable. And this is done by helping people manage long-term, often complex health problems and injuries and chronic ailments, and have them retain their function and their quality of life and life expectancy. So moving on to the next part of the presentation, which is basically a quick run through, which I will just go through very quickly. As we all know, one of the most impressive aspects of our madam is Amma's direct involvement in disaster relief and disaster risk reduction. And I'll just run through a few of the programs that Amma has personally supervised, and it shows the extent of disaster risk reduction that has been involved in every project that Amma has supervised. Embracing the World is a global network of humanitarian organizations and initiatives of the mud. And basic needs of the people in terms of food, water, shelter, healthcare, education, and livelihood are provided wherever and whenever possible. The Swachh Bharat mission, new building of toilets, green fronts, tree planting of more than 1 million trees, all of which really increases the sustainability of the programs that have been shown, and also the risk reduction effects of each of these programs. The healthcare project in Lakshadweep was a unique project where we were able to provide primary and secondary healthcare locally and tertiary healthcare at the mainland. And this has resulted in a substantial reduction in the cost of healthcare to the tune of about 100 crores annually. We had deputed doctors, nurses, and paramedicals to the service in this remote area, and there was a significant reduction in emergency evacuation, which can only be done by helicopter, and thereby huge financial savings savings were made to the government. The Tsunami Relief and Rehabilitation Project is a massive undertaking covering a broad range of relief efforts in India and Sri Lanka. The Amala Bharatam campaign aimed at improving public health and restoring India's physical beauty. And through this campaign, Amma is calling on all citizens of India to embrace practical new initiatives to clean public places, promote health through hygiene, sort garbage, recycle, and properly dispose waste. Gujarat earthquake was a phenomenal involvement of Amrita. The earthquake that hit Gujarat was one of the worst disasters in Indian history, and thousands were killed. And the MA Mutt completely rebuilt 3 villages and 1,200 houses, in addition to schools, community halls, and water tanks. So this builds resilience and help reduce subsequent severe catastrophes in subsequent environmental disasters that may come about. Uttarakhand floods, Chennai floods, all of these are really efforts at not only taking care of the immediate emergent medical emergency, but also build resilience, and risk reduction helps in reducing the impact of future catastrophes. These are all the various disaster relief efforts where we have substantially contributed to the tune of 8 to 10 million US dollars. Kerala floods was the most recent of our disaster relief efforts, which hit Kerala in 2018, and more than 500 people were killed and millions displaced. The 24-hour helpline to reach people in distress and save lives was an immediate impact of the community's efforts, and more than 25,000 calls were fielded and connected over 100,000 flood victims with appropriate rescue and relief services, including the Navy and the Air Force. COVID-19 relief projects is an ongoing project which we are in now, and our youth initiative is running a COVID resource center to help patients and their families throughout India. Research for a better world. Research is something, and it's evidence-based activity. It's very crucial for disaster relief and spanning a diverse array of disciplines. Research includes nanotechnology, biotechnology, robotics, and satellite-enabled software. Sensor network system for landslide detection was shown in detail. Amrita researchers deployed the world's first ever wireless sensor network for landslide detection, and the system uses wireless sensor technology to provide advanced warning and impending landslide. And this is clearly in line with the risk reduction strategy that's needed for disaster relief. Telemedicine we were one of the early deployers of telemedicine services through the Indian Space Research Organization, and medical information processed from remote centers such as Sabarimalai, Amritapuri, and Andamans were reviewed at the hub center, the AIMS hospital, and it was used extensively to facilitate embracing the world's relief work following the Indian Ocean tsunami. Mobile telemedicine units are used to reach out to the communities and also make available diagnostic services in remote areas. The Amrita Setu Bridge was inaugurated in 2006, and the bridge provides a centralized escape route, allowing 15,000 people to evacuate in 30 minutes. And this is a classic example of risk reduction in the event of a future tsunami. Powered air purifying respirator through our research and development wing at the engineering college. This was developed and found to be extraordinarily useful at a low cost. So with that, I will close and close with a quote from our beloved Amma. When a disaster or event impacts the world on a global scale, we should view it as a karmic consequence of the cumulative actions of the world as a whole. Om Amriteshwari Namaha.